I'm Dr. Steve Lininger. Today we're going to talk about chiropractic and pregnancy. Now, I treat a lot of pregnant women and have over the years, and we adjust quite a few of them. We just have to adjust them a little differently than we did before they were...
Sorry. I'm sorry. I am so sorry.
It didn't leave.
Somebody called Giselle. She was going to call me later. Sorry.
Hi, I'm Dr. Steve Lininger. Today I'm going to talk to you a little bit about chiropractic and pregnancy. Now, pregnancy, I've treated a lot of pregnant women over the years, and we adjust them just the same as when they were before they're pregnant. Well, not just the same. We have to modify how we adjust them a little bit, but we still keep adjusting them while they're pregnant. We don't take any x-rays for a pregnant woman or a woman that might be pregnant, so we have to use different ways to find subluxation other than the x-rays. However, you definitely need a chiropractor when you enter pregnancy because you're going to have changes to your body, and some of those changes are going to affect your back, and the biomechanics of the body change, and it's a really good thing to keep your spine aligned while you're pregnant. Now, some people have asked me, women that have come into my clinic have asked me, some women have had trouble getting pregnant, and they've asked me, can chiropractic help them get pregnant? And let me show you, the short answer is not really and not directly, but indirectly it may assist in creating a non-hostile environment for conception and carrying a fetus to term. So let me show you what I mean by that. Okay, so a lot of times a woman, they don't typically come in asking me if I can get them pregnant. We're not a fertility clinic. But what they will ask is, well, they'll come in with back pain here, and they'll have a lot of inflammation, and so I'll ask them a bunch of questions about the nerves in the lower back, which by chance don't just go to the muscles in the back. They also control, as you can see here, they control the large and small intestines, and then the lower nerve here, the pelvic nerve, controls the sexual organs, the bladder, the kidneys, and also the reproductive system in the female. So a lot of times when they're having symptoms such as back pain or leg pain or sciatica or nerves, these nerves, they turn from yellow to red. So they become hot, like a red hot poker. And they get inflamed, and that fire can spread anywhere the nerve goes. So if they're trying to conceive and that nerve is inflamed, inflammation doesn't just stay in their back muscles, it spreads down the pelvic nerve and can affect the reproductive organs of the female. In some cases, not in all, but in some cases, I have seen patients who cannot conceive are also getting back pain. They come in and we start adjusting and we calm down their symptoms of their back pain, and in some cases I have seen women conceive. Because when we put the fire out, the body now is no longer a hostile environment for conception or carrying a fetus to term. Now, that doesn't mean that I'm telling you that chiropractic can get you pregnant or getting adjusted. My clinic will help you conceive. So I would never tell a patient that. But have I seen patients that come in that have severe inflammation along with their back pain and leg pain and are having trouble conceiving? Yes. Have I seen them been able to conceive once the inflammation is decreased? In some cases, yes. In some cases, no. I can tell you this, though. Inflammation is never a good thing. So you want to if you're trying to get pregnant and you're having inflammation, you want to definitely put the fire out and see what happens. So that's what I can say about, because I get that question quite a few times from females in exams. And that's kind of what I explain to them, is that inflammation is never a good thing. You should always try to decrease the inflammation and then let the body naturally heal itself, and then the processes start occurring naturally again. So in some cases, we have seen patients come in, could not get pregnant, start getting adjusted. Not only does their back pain go away, but they tell me that they're able to conceive now. And they attribute that to whatever, and you can attribute it to whatever. I can just tell you that decreasing inflammation, good. Reducing inflammation, good. Increasing inflammation, bad, in all cases. So I would never tell you that chiropractic can help get you pregnant, but it can reduce inflammation, and when you reduce inflammation, a lot of good stuff can happen in the body. I'm Dr. Lininger, and that's all for today. I'll see you on the next video.